Okay, to conduct the secondary survey, I would start off gathering the patient's medical history, and I would use the mnemonic sample to go over, to see what signs the patient is showing, and then, if there's any bleeding or just notice the breathing issues. And then I would go ahead and ask the patient about their symptoms. And then I would go over any allergies that the patient has, whether it be, medication or environmental, food, anything that just is relevant to what's going on. I would ask the patient about any medications they're on, whether they're prescription or non-prescription. Then I would ask for any pertinent medical history. So, just ask if they've been recently hospitalized or something that's an issue that's been going on. Then I would ask about last oral intake and see when the last time they ate and what it is that they ate, possibly if they've had any fluids, and then I would ask about any events leading up to said incident. And then I would continue on to just doing a brief physical examination. And so I would do like a head to toe examination. I would, check the head, look at the eyes, see how the pupils are reacting, if they're reactive to light, if they're dilated, if they're even, just making sure there's no deformities or anything in the neck or head. Then I could also check the nose, see if there's any fluid coming out. Check the shoulders, the chest, just to make sure that there's nothing going on. I could look for maybe possibly, just make sure they don't have a punctured lung or anything like that. And then just notice, what sound their lungs are making while they're breathing and kind of have a feel for that. I would check the abdomen. I could palpate, just around the abdomen and see if there's anything going on there. Check the pelvis. It's kind of hard on my little bunny, but check the pelvis. Just, also asking the patient if there's any pain while I'm checking all of this, or if something doesn't feel right. You could also look for incontinence while you're checking the pelvis. You could check the legs, the feet, just continue asking if there's pain. Also, just noting any deformities or just anything that's out of the ordinary. And then I could check the arms and the hands. While I'm doing that, could do a recapitalization test. And then, just make sure that both sides of the body feel the same, or if there's something, noting if there's something that's different. And then I would ask the patient to, or help the patient roll on their side and just leave them in a side lying position. Also bending the knees just while they wait for the next set of professionals.